Okay, so you know, when it comes to recovery time in men, like I said, is different from that of female, right? And the question I was asking before I stopped was why women recovery time different from men? And it's very simple. It's very simple. As if you were here when we were talking about it yesterday, right? You know that for men, um, when ejaculation takes place, right, prolactin level spikes. Prolactin spikes. And when prolactin spikes, erection shuts down, right? So men have a clear off and on switch when it comes to recovery time. That is the reason why when a man ejaculates, it goes off for a while, depending on his age and health status, right? So, yesterday we talked about the details of it. So, some of you men that are trying to kill yourself to impress, don't impress anybody. You don't expect a 40 years old man, 50 years old man to perform like a teenager or a 20 years old young man. It's not going to work. A teenager, early 20s, they have a recovery time about 30 minutes. So they can spend the whole day having up to 8 rounds of sex, 8, 10, the whole day. That's why some of you, when you got married, or rather, today you are thinking of before you got married. So this my husband was so powerful. We used to go for 10, 20 rounds when before we got married. Now we are married. You hardly can see one round. And you begin to wonder what's happened. Nothing happened. It's the few factors that happened was age, responsibility, which is affecting um, their their emotions, their psychology, and all that. So all these are factors that affects how many rounds a man can. I saw a video, and I wish the followers of that individual and the woman is actually on this live stream. The lady was saying that married was actually maybe she's taunting married women that yeah, when was the last time they saw more than one round in their marriage. But that is an ignorant post, actually. It's an ignorant post because you cannot compare your husband when you guys were in your 20s and your husband when you're in your 50s. So several things, right? But it can be improved. But several realistic things happened. So you do not taunt or cause women to want to think that they should leave their marriage because you are still in your 20s and you're having up to 50 rounds a day. Don't do that. Don't do that. It's criminal, right? That's wicked. Because if you have not started paying bills, you can go several rounds. If you have not started taking real responsibilities, the only thing you think about is to prepare for, or maybe you're just a sugar boy, right? Where your bills are paid for and stuff. So and stuff. Then for those who are under medication, we talked about how that certain medications like antidepressant, BP drugs, antipsychotic drugs, and some steroids actually affects um, the, the recovery time and even affect erection in men. So several things, and that's why we don't want to leave any man ignorant. But for women, it's kind of different, even though we are calling it recovery time. It's not in that sense. Women don't have the on and off switch like men do. For women, there is no um, there is no ejaculation. There is orgasm. These are two different things. There is orgasm, no ejaculation, right? There's no mandatory shutdown like men would have to wait for recovery time. and women can sometimes have multiple orgasms. Yeah, multiple orgasms, but still experience neurological and hormonal shifts. So there are several things to look at. So instead of this manly like refractory period, what women have is a recovery spectrum, not just like an on and off like men do. So basically, what happens in female body after orgasm is just few things. There is the hormonal change that happen. There is the nervous system response that happen. There's the physical sensitivity changes that happens in women. Uh, to look at them in details, should I look at them in details? Is somebody listening to me? Should I look at them in details, or I should just jump and pass and give it to our subscribers? All right, right. Mm. All right. We are not looking at them in details, so let's go and look at other things. So somebody asked a question which the answer is very obvious. Can women have multiple orgasms? Yes, of course, but it's not always so, and not in the same way for every woman. Right? There are two types of women. I would say three, because of because I've interacted with women for many years now, so as patients, and I know the kind of things I have to explain. So I would say three types of women. There are those that are capable of multi orgasms. There are those that are capable of single orgasm, and of course they will require recovery time. And there are those that are capable of zero orgasm. They don't even know what it means. So, but again, regardless, all cases they are healthy and is natural. The difference is just knowledge, right? For the multiple orgasm gang, they can those category of people climax quickly, right? And they often need emotional safety and gentle stimulation to achieve that battery of orgasms, right? Oma Wumi is here. You're welcome. Then the single orgasm gang, these ones they need time before the arousal return. That is why I used to hear some people. I would say they are like broken down engine that you have to pull on the ignition severally before the engine starts. So this is the gang, the single orgasm gang. It's very normal and it's very common. In fact, most of the women are in this category. Just a few are in the multiple orgasm gang. Then the older women, because of information, belong to the zero orgasm gang. They don't even know what you're talking about. Years ago, more like uh, more like 13 years ago, I think I was interacting. In fact, a patient asked me point on. I think the woman was in her 40, she was 45 at the time. And I said, doctor, what is this thing they call orgasm? What does it feel like? I said, how did you arrive at having up to 5 children? You don't know what orgasm is. It's not her fault. She doesn't know. She has never heard. The only time she heard was when, you know, um, the saloon parliament women. You know what I'm talking about. If you know the saloon parliament, if you want to hear all kind of gist, even the ones you've never heard before, go to the saloon and listen. You will hear all manner of things, right? So she asked that question to know whether she has some medical condition. There's no medical condition. It's just that you don't know, and unfortunately, you are in the such people are supposed to be in the single orgasm gang, but unfortunately, they are not knowledgeable enough, so they fall in the nothing is wrong with them. They just knowledge gap. And unfortunately, there are some, especially those in that category of people that grew up in the village, how that genital mutilation was common in those days. So all the sensitive parts of their genital has been removed. So that is basically what made them to be in the zero orgasm gang. So they can only hear about it, but they may never in their lifetime. Right? So such was the case. For many women, orgasm actually opens emotional layers in their relationship, right? The post orgasm emotions may include closeness, vulnerability, tearfulness, those who cry after. Can you imagine? See, I tell you, people may cry for everything. You cry after orgasm, cry before orgasm, cry during childbirth, cry falling in love, cry falling out of love, all manner of cry. And of course, emotional release and sleepiness, which is a physical uh, commonality in almost all the cases, right? So, and all these I just mentioned is actually due to oxytocin release, right? Oxytocin is released, um, cortisol, which is stress hormone, is reduced. Then you have this psychological openness. Before you know, off you go, you sleep off, and life continues from there. So that is why aftercare matters, right? That's why, for guys that are listening, that's why sometimes, women feel like they are now vulnerable because they've been intimate with you. This is the reason, right? This is the reason. So if the aftercare does not come the way it should be, they feel like they've been either been cheated, they've been misused, or feel sorrowful, right? Even when it was consensual, even when all of you agree, even when you are in love, the aftercare matters because of that psychological openness and vulnerability that they feel. Right? So there is no specific recovery time for women. It's just a spectrum. And depending on where you are, you can be in the zero gang or you can be in a multiple orgasm gang. And that's where you are. Right? But it's also there's also the short term recovery, post sex short term recovery experience. Usually that will last from minutes to hours, depending on the individual. Hi, how are you? Good to see you. Is that Shelby? Shelby, you're welcome. Right. So these are the issues. For those in the postpartum, the long term recovery, we call that the postpartum recovery. After birth, recovery is not hours or days, it's actually months, right? Why? Because there are several shifts that happens. You see, never because of intimacy, sexual intimacy, break your relationship. You'll be making a mistake. You'll be making a mistake. And this is the knowledge you need. Because when you give birth, several things shifts for the man and for the woman. What do you want to ask? Shoot your question. Shoot your question. If I come up and ask the question, right? So, what changes? What changes postpartum? Several things, but just a few I want to mention. And of course, the very first one that changes is 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 hormone. There is hormonal crash. There is dramatic crash of hormone, right? Estrogen and progesterone drops sharply. Prolactin rise, especially with breastfeeding. Testosterone decrease. Of course, women have testosterone too, right? When in certain level. So all these hormonal crash will lead to will affect libido. That's why you notice for some women, you notice that your libido crashes after you deliver, right? Vaginal lubrication is poor, right? Mood has changed. You that used to be lovey-dovey, and that's where people make the mistake. They now think that because they've delivered, maybe the attention has shifted to the baby. Yes, it does, but there are other hormonal factors that are at play. The woman did not dislike you as a man. No, this shifts is what is causing what you are noticing. So do not now be angry. Say, okay, this woman don't become something else. Let me go and look for somebody else. Well, in this world, there are two categories of men. There is a single gang men, those who uh, they believe in one man, one wife, and there is the polygamous gang men. So if you are, depend on where you are, you should be able to manage what is going on here. So this delivery that has happened will affect libido in the woman, vaginal lubrication in the woman will be affected, mood will be affected, even energy. That energy, especially you see, why is this so interesting? From the time of the wedding to the time of birth of the first child, the experience at that time is usually different from after the first child come, every other thing changes. And this is where a lot of people make mistakes, especially women. They now feel like, I'm not having the fun I used to have before, therefore I want to leave. Leave to where? The same thing you experience in the next and the next and the next until you become old. So what is the friend's problem? Shelby, I need to know what exactly is her problem. Trying to conceive is not the problem, right? So I want to know what's the specific problem. All right. So I said all that to say, um, hormonal crash is one of the changes that happen postpartum. Yeah, there is the physical healing that needs to happen postpartum. Postpartum means after birth, right? Physical healing that needs to happen. Why? Because during delivery, several things happen. Vaginal stretching. For some people, they have tear, right? For some others, they have to go through cesarean section. For some others, the pelvic floor is weakened. Of course, in all cases, but it depends on what degree, right? Then uterine contraction. So there has to be physical healing that has to happen, right? And because of that, sexual comfort may take weeks or months. You know, just a few months ago, a, a certain couple had their baby through cesarean section. While they are still in the clinic, they were already taking permission. Doctor, can we start? Right in the clinic? Are you serious? Is that how you people's blood is hot? They want to start action right there, right before they get home. Oh boy. You see why it's good to marry early. You go enjoy your life before old age comes. So they wanted taking permission. Dr. Alpha, the woman had tears 2 days ago. The wound is still healing. They're already seeking permission. Make no time, actually. There's no time. No time. So, so When I said that, you see the difference between young people and older people, right? If it's older people, their recovery time, both for the woman and for the man, is longer. So these are not the kind of things that goes through their mind. But when you are young and your blood hot, so why is this baby disturbing us? They want to carry the baby and throw in the other room, right? But if you were here yesterday, I think you have a better understanding of what I'm talking about. But again, there's also the hormonal changes that happen postpartum. Yeah. And I'm doing this because I'm having this discussion from yesterday to today because it's usually unreasonable for anybody to say you want to break your relationship because you are not feeling the fire anymore. Fire of what? Right? Fire of what? You don't know. You don't know the changes that happen. These changes is what happens and you think you are no longer loved. Who told you you are not loved? No, it's normal biology. Right? It's normal biology. Because if you leave this one, the same normal biology will play in the next one. Until you get to the age where all your fantasy years are gone. That's why I always advise people marry early. You will enjoy some of these things better than when you're already old. You know, when you're in your 40s as a man, your recovery time is hours or even days. So that's why it will look like older people are not, people say I like sugar daddies because they're not interested in sex. Who told you? Their recovery time is long. So when you are within your recovery period, that's not what's going through your mind. So they rather spend that time making money, right? But if you are with a younger person, recovery time is short, 30 minutes, or even less, depending on the age, right? So be smart. I thought she sent a request. All right. So yes, there's emotional shifts, right? There's emotional shifts that happens. Focus on the baby. There's postpartum anxiety. There's even postpartum depression. That's why I advise couples go through this thing as a team, so that you understand where this person will support, where your role lies. All these basketballs fighting, it does not make any sense. Do not mistake biological change for loss of affection. No, don't do that. You are not knowledgeable. You're not knowledgeable. And that's why when they go and regret and try to come back. No road again. Right? So to be smart. And you know that even postpartum changes that happen, there's also the aspect of identity shifts. You'll be amazed. You see what I tell you? I tell you that the way recovery time happens in men will just like switch off on. For women, there's a there's a battery of concern, especially when on the postpartum side, right? There's the identity shifts. The woman now is moving from being a single married woman to a mother. That is a quantum shift, actually, because there is no time you can ever be experienced in this business. Once upon a time, you are single. Once upon a time, you are married. Then you move from married to mother of one. Then you become mother of two. Nobody become an expert of motherhood. Why? Because if you are a mother of one, that was your first experience. Then the second one come, it is still your first experience of being a mother of two. Then the third one comes, it's still a first experience of being mother of three. So a clear understanding of how life works will help you. So that is an identity shift, and that also can affect the can influence the affection that happens, and also recovery time. Recovery time is all about desire. Um, uh, for women, the desire for wanting sex. For men, is the amount of rounds they can go. Right. So a woman will transition into motherhood. She will transition into caregiver. Right. She will also transition into a protector, all at the same time. Lady B is here. Happy New Year, Lady B. Right? And because of all these shifts to motherhood, caregiver, protector, sexual identity may take time to return. You see, your spouse that you got married to that is all over the place. Hi, your name is all over the place. Now, this shift, identity shift has occurred. You are welcome, right? The identity shift has occurred. What happens? That pursue, that lovey-dovey behavior is no longer there. You see, she don't love me. She don't leave me go follow her pikin. Now she love her pikin more than me. It's not true. It's not true. It's just a biological change. Well, for some people, that's where foolishness starts. Instead of supporting, foolishness starts, and it causes a lot of trouble, right? And that's the reason for the broken society we have now, because we have almost everybody running all over the place without sense at all. So, what then is normal after childbirth? Well, anyway, very normal experiences after childbirth is you experience no sexual desire for weeks or months, depend on by what means you the outcome of the delivery, whether CS, whether you had tear, whether it was so strenuous that your pelvic floor became weakened. Depend on all that. So no sexual desire for weeks or months. Unlike our wonderful young couples who wanted to start the business while still in the hospital. Right? Then, if for any reason you want to begin the business, right, pain and dryness during sex will be experienced. Yeah, will be experienced because of the things I mentioned earlier, the hormonal shift, right? Even emotional detachment is there. And this is where all the troubles that has led to broken home, maybe not all, but most of the trouble that led to broken home, this is where it reforms. Emotional detachment. And they feel like, oh, the love is no longer there. It's there. You are just foolish. It will happen, right? Especially for those that are giving birth back to back every year. One time a certain woman starts I think she was pregnant, you know, and she said something that got my attention. She said, "This my husband is wicked." I said, "No, he's not wicked. He's not wicked. It's just that he doesn't understand you now that you're pregnant, right? So he's feeling like you are no longer in touch with him, and you are feeling like you're no longer in touch with him. So all of you are just doing like foolish people, parting ways. Rather, that's the best time to use understanding and come together. But I hope sense enters some people, right? So there is that feeling of out of touch. So I don't even understand what did happen again, right? And that need for emotional closeness will increase. And this is not failure, but just biological change. And this is what recovery is like in women. You can only be concerned that there is a problem when, in fact, go and seek professional help when you you having intercourse and the pain persists beyond 3 to 6 months. That is postpartum. If you have complete loss of desire that will cause you distress, go and seek help. Those people that have depression, your depression is not perpetual. You're supposed to recover. So if you're not recovering from your depression and it's affecting your bonding, go and seek help. Go and seek help. Right? Even now you have healed and you're still having painful intercourse, go and seek help. There is help for everybody. There is help for everybody. The problem is no knowledge. And I always say, whether it's fertility challenge, whether it's health challenge, general health challenge, whether it's even relationship challenge, it all boils down to lack of knowledge. And a lot of ignorance has caused us a lot. All right, so there's so much on that, but I will stop here so that you can just answer one more question before we go. Is that okay? So where is she? She's still here. She said she wanted to ask a question. She's no longer here. All right, so guys, let's ask question before I call it a day. This is what's the time? Almost 8:30. Yeah. So if you have a question, send your send your request. Come up, ask your question before we go. If you are just joining, you're welcome. And if you are not following me yet, this is the time to follow me. Loisa, Happy New Year. Happy New Year. So, who is asking a question? Ask a question now. Follow me now. The next time you see me will be on Monday. On Monday, we are going back to third trimester pregnancy. As we, in a few weeks' time, we will end this season. In a few weeks' time, we'll end this season and we'll start a new season. So everybody you know that is trying to conceive, that have fertility challenge, get them to join the new season. If they miss it, well, they will just suffer and pay too much for what knowledge would have done. I saw a question. Was it Lady B? I saw a question. Did you delete the question? I can't find it anymore. Or is it TikTok that removed it? Anyway, so ask your question, then we'll go. In 20 minutes, in 10 minutes, sorry, I will be out. Send your request, ask your question, and let's go. Says I gotta be strong. Sometimes it ain't the dream they plan, but they hold on tight, love close at hand. What? It's a joy and a storm. What? I don't understand. Name. What do you mean? What do you mean? I don't understand the question. A procedure for what? Loisa. Loisa, good to see you.
Yes, Doc. Good to see you too. Happy New Year.
Happy New Year to you. You are welcome.
Thank you. It's my prayer that this year abundant grace shall be our portion. Amen.
Amen. Amen. In fact, before June, 20 of the people that are listening to me will become pregnant, and they will
In
change
Jesus'
status.
mighty name.
Amen. It will happen.
Amen.
20. Amen.
Doc, please, I'm making this inquiry for a friend, a female friend. I was having a discussion with her. she was discussing some
Mm,
fertility challenges with me. I actually don't know much
mm.
about it. She's had some scans done, and she's telling me that she's going a local way, been given some herbal medicines. She's scared of the surgery. Okay. So my confusion here was how big is the uterus that she's saying that it should be removed. I wanted to just know. So I asked her to send me a report. So she sent me a report, but the interpretation, I just want you to help me so that I'll know the best advice to give her. Because she's still going local, saying that the local medicine can shrink the uterus. That I don't believe it. So, and
Wait,
she's finding it
what is
difficult.
wrong? What is wrong with the uterus? Let's start from there.
Okay, uterine fibroid. That was the diagnosis she said they made.
Okay.
So on the
So
scan reports, I jotted this vital point down. They said the
go ahead. Are you there? Is it my network?
measuring 10.4 times 8.0 times 7.4 centimeters. Is it
Okay.
so?
So I can say from what you hello, are you there? Is it your
There is no
network or is
math.
mine? Is it your network? You're
Sorry?
breaking.
Oh,
Okay. I think I heard you say 10.4 by 8.
please, can you hear me?
I can hear
Yeah,
you now.
10 by 8. 10 by 8 by 7.
Mm-hmm.
It's 10.4 by 8.0 by 7.4 centimeters.
Okay, so the easiest thing to do, right? The easiest thing to do is just to say she has a mass that is about 10 centimeter in diameter. I think that's the easiest way to understand it.
Mm-hmm.
That's pretty
Oh,
large. That's pretty large,
okay.
right? So how old is her? Is this person?
She's 40.
Ah, and she's trying to conceive.
The boyfriend is saying without conceiving, she's not gonna marry her. So,
Loisa, you know
Doc,
something. You see the
no.
reason why I always advise women to start having
Mm-hmm.
kids early in their 20s
Mm,
because it will save you a lot of stress, right?
mm, mm.
Now, would you blame the partner for making that demand? No, you won't.
No, please.
Now, this is what I would advise.
Mm,
I wish I was even talking to her, but
mm.
let us take you back as a messenger. Carry the message back,
Yeah.
right? This is what I would
Mm,
advise. First of all,
mm-hmm,
because of her age, fertility
mm-hmm,
chances is low, right? For obvious reasons. For obvious
mm-hmm,
reasons, both quantity of egg reserve and quality of egg at that age, quality is poor, quantity is low. So that's
mm-hmm.
why fertility chances is always low, about 20-15% chance, right?
Okay.
Now that's one. Number two, with fibroid on the way, has she had any child before, or is she just want to start at the business of the day?
No child, no child.
Ah, wahala, wahala. Now this is my problem. This is my problem.
Mm-hmm.
Our African people are very wonderful. If it is not from their womb, if it is not from their egg, they will not consider it to be their own. Otherwise, the easiest thing for her to do is get a surrogate. If her egg quality is still good, get a surrogate and have a baby and for her to go and rest. Right? Because I cannot sit down here and still guarantee you that you still be successful after you remove the 10
Great.
cm mass. I cannot guarantee that because again, we'll still have to look after removing the mass. We'll now have to look at the health of the uterus. You're right. Forget about that drug she's taking. She's just wasting her time. Right. We have to look at the health of the uterus. Is the uterine lining rich enough for implantation, which is usually the problem at such age, versus the quality of egg, versus the quality of embryo that will be formed. More likely, the person, our partner is older than her, more likely. So you are dealing with sperm quality versus egg quality versus so much. Let her just get a surrogate. Let her get a surrogate.
That's the only option.
That is what I brutal truth. Let her get a surrogate. Otherwise, she will spend money tire. Right? She will spend money tire. But again,
Okay,
I
her
also
financial
believe.
status.
Go ahead. Go ahead. You mentioned financial status.
Looking
I'm
at her, I
listening.
don't think the finances can be able to do this thing. It's enough to do that. And then the uterus is
Even if
also
she has the
growing.
money,
Isn't it dangerous to her health?
what is uh, what is dangerous to her health?
The mass growing in the
Okay.
fibroid.
If she has symptoms as at now that we're talking, like maybe excessive bleeding, pain, discomfort, these are the reasons why she should even take it out.
Okay.
But even after taking it out, I cannot now guarantee you that you still be successful
Fertility.
because the chances are already poor. Do you understand? So
Yes.
for health's sake, take it out. But who knows? Miracle can happen. She'll just she'll just call you one day, say, "Hey, I'm pregnant." Right? So miracles can happen. How they say it here in Nigeria, they say miracle need retire Jesus. Right? So miracle can happen. So
Yes,
please take the message back to her. Take the message back to her. For her health, she can take it out. But however, focus on either a surrogate,
the
especially
surrogate.
if we cannot achieve a good quality endometrial wall. Let's get a surrogate. Make we rest. Is that okay?
Okay. Doc, please,
Go ahead.
so the 10 cm in diameter, like you said, it's quite large. But I asked her if she could feel it in the lower abdomen. I feel at least you should feel something in the lower abdomen when you lie down or something. She said she does not feel anything or any mass anywhere. So,
What's her body habitus?
sorry,
What is her body habitus? Is she on the thick side or slim side?
she's slim. She's slim.
Okay, so
That's
if
she's
the
slim.
if the ultrasound is still possible that she may not necessarily be feeling symptoms, you understand, right? So if the ultrasound shows that she
Okay.
has fibroid, I think she has fibroid. But again, if that's the first time they are pronouncing it to her, she may want to get a second opinion.
Okay.
Yeah. So do
Yes,
all
please.
these things I just mentioned, and we are sure to We're sure to get a better result in time to come.
It's okay. 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 Yes, please. I'll tell her. I'll let
You're
her join
welcome.
the live. Then okay. Thank
Let her
you.
come. Let her come. She may just be
Yeah.
one of the 20 people before June that will be pregnant.
I'll tell her. I'll tell her. Okay.
All right. Thank
Thank
you
you.
very much. You are welcome. Um, Esco Patrick, you are welcome. Welcome in.
Good evening, sir.
Esco Patrick, good to see you. Happy New Year.
Same to you.
So talk to me. What's happening?
Yes, I'm having discomfort.
You're having what?
I'm 30, discomfort.
Okay, okay, okay.
33 weeks and 4 days pregnant.
What type of discomfort?
My stomach is very tight. I can't eat much.
Okay. You say
Yeah.
if you want swallow fufu, you want chop fufu. Calm down.
I
You
don't dey
say
eat like before
you like
again.
chop. Okay. Were you here when we talked about Braxton Hicks? Were you here?
No, no.
Yeah, I know. Una need a day when they talk important things. Una no go day.
Hey, yeah. Oh.
Um, so okay. Beside the discomfort, what other matter?
Yes, I feel pains and vomit also.
Okay. So you don't actually have any major problems, right? Hope you're not
No, not
bleeding.
much. No, not at all.
Okay. The vomiting, is it severe? So much so you can't keep
No,
food in your
no,
stomach.
no, no, no,
So calm down. Calm down. Calm down. You'll be fine. Have you done ultrasound lately?
no.
Why now? Go and check your baby now. I don't know what did happen.
Okay, I'll do
Are
that.
you doing antenatal?
Yes, yes, yes.
Good. Mommy B, please come up. So when you go for antenatal, I'm sure they will send you for ultrasound. Just let's
Okay,
see the status of your baby. Besides that, you
okay,
don't have any major problem, right? Is that okay?
okay. We almost every time.
Don't worry, you don't have any problem. So calm down. Calm down. Tell your oga to be rubbing your back. Now their ministry be that.
Oh, okay, no problem. Thank you. Thank you, sir.
You are welcome. So while you are doing your own, your oga should be doing his own. You will be all right. Is that your first baby? Let's go.
Yes,
Is that
my
your first
first.
baby? Oh, your
Yes,
first baby. Okay. Okay.
yes.
Oh well. Don't worry, you'll be fine.
No problem. Thank you very much.
Mommy B. Mommy B, come up now. You are not even following me. Tap on the plus button here and follow me. Right? Tap on the plus button, follow me. Then okay, let me send you a request. Let me send you a request to come up. If you want to ask question, better come up and ask me question now. Because where is Mommy B? I can't find her. Mommy B, are you a ghost? I not see you. Mommy B, I don't know. Many of you are hiding your. Many of you are hiding your. I can't find you. I have 14 people in the viewer's eye. It will shock you to know there's only 5 people that I can find. So all these people are just hiding. So if you are hiding, there's nothing I can do. But while you are hiding, make sure you are following me So that would be a smart thing to do. Mommy B, I can't find you, and I can't bring you up. I need to hear from you. Okay, you are even new to TikTok. You are new to TikTok. Is it new to TikTok? Or is it a new account, sir? Okay, just type your question since I can't find you to bring you up. I can't find you to bring you up. Just type your question. Let's answer you from there. Of all these 15 people, where are they? I can't find them. All of them are hiding. I can only see Mommy Nathan, Chi Baby, Sharon Z. All these people that they follow me. User Jumi. User Jumi is here. Good to see you. Nelly is here. Omawumi MSEC and Antonia Obule. The rest are hiding. I want to get Amen. This month, no, I don't do magic. I give you knowledge that will help you, right? I give you knowledge that will help you. So this month, forget about this month. You need, because normally, if I don't miss our next season that is coming, right? Because I'm going to start with how to prepare your body before you even try to conceive. When some things you do, you don't need drug for them, right? So this month, forget about it. Well, miracle can happen. I did not say it is not possible. I'm only telling you that if you want me to do something that will make it happen, I cannot do magic, right? So just exercise some patience, because we're going to talk about the things that you need to do to prepare your body before trying to conceive. Then we'll go on to talk about your fertile window for those who have regular menstruation, and those who don't have regular menstruation. We're going to help you calculate how to know your fertile window. So much to learn in the next season. You don't want to miss it. Anybody you know that's trying to conceive, you let them join that season. You'll be, so much is packed there. You're on your period now. Good now. Right? Good. So you start counting from the day you start your period. Know the length of your cycle, then know when your ovulation is supposed to happen. Then fire at your ovulation time, right? So that's what you need to do. So I was talking about the season that is coming. Oh boy. When I tell you that 20 people who are listening to me are definitely going to get pregnant before June, I know what I'm telling you. I know the quality of information that I'm bringing you for free. So you don't want, please invite everybody. Let them come and learn. Right? Like somebody said, she wants to stop preparing her bed and come back from work and the bed is still remaining the same. Nobody scattered it. So that will not be your story this year, 2026. Those days are gone. In fact, you go shout for picking tire. Hey, sit down here. Hey, go there. Hey, why are you like this? That's the joy of every mother. Right? So such will be your story too. So get them. Season 2 is coming. By the end of January, we are beginning another season. So, and it's going to be very beneficial to many. That is why I want people to join. Blessing TV. No, we need to know the length of your cycle for me to be able to answer that question. You need to know your length of cycle. Is it 21 days? Is it 28 days? Is it 35 days? All right. So if you know the length of your cycle, you can now know when ovulation will take place. Possible date, actually. And if you know the ovulation day, you can know your fertile period. And you take advantage of your fertile period. Right? Unless there's another problem somewhere. You'll get results. Calm down. Right. So that's what we need to know. We'll get married. Wait, oh, Loisa, what are you saying? Who will get married in February? That still does not answer the question. Or you get married in February, then you start firing. Okay. I beg fire waiting no good. So long as you produce results. Right. All right. So blessing, just find out how long is your cycle, right? How long is your cycle? Then 14 days before the next menstrual bleeding will be ovulation day. 3 days plus the ovulation day, that's 4 days of fertile window. Focus on those days, you'll be fine. I hope that helps. But if it doesn't, you have to wait until we start the new season. Is that okay? Um all right. If you have not followed me, follow me now. The next time you see me will be on Monday. Monday to Friday, 7 p.m. Nigerian time is when I go on live. But you can see me maybe on another platform, just having a general health discussion. That's what I do on TikTok. I don't have another idea of what to do on TikTok. Antonia, 2024. Uh-huh. You go wait now, Antonia. Why your blood dey rush? Huh? Your body needs time to. Your body needs time to adjust now. Huh? It's just few weeks after you win your baby. Calm down. It will come. It will start. Is that okay? Calm down. There's nothing wrong with you. I hope you understand, Antonio. There's nothing wrong with you. Just wait. Your body will adjust. You just stop breastfeeding now. So, if you're just joining, you're welcome. Make sure you're following me. Follow me. I have lots of videos that will be beneficial to you on my profile. Lots of videos. Please go to those videos, learn just 1 minute, less than 1 minute video. So much to learn from the uterus and the diseases that can happen in the uterus, the ovaries, the diseases that can happen in the ovaries, first trimester pregnancy. So much to learn, right? When you do that, you'll see that it's easier to understand the 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 your body better, right? All right. So in 5 minutes time, I shall be gone. So guys, I want to thank all of you for joining tonight. But I'm very hopeful that in this 2025, before June, 20 people that are trying to conceive. I'm not talking of people who just got married though. Those ones when I just go the born. I'm talking about those who are trying to conceive. Conception is a matter. Listen to me hard enough. By June 20 will report pregnancy positive, and you'll be amazed. We've already reported those for December. I can't even find them again. They don't carry their pregnancy. They are doing whatever they are doing. Thank you, Omawumi. Right? So all those people pregnant in the December, I can't find them anymore. But I'm sure when they deliver, we shall see them again. Location of where? This is the place. This is the place. This is the location. On live stream, 7 p.m. Nigerian time, Monday to Fridays. This is the place. Invite everybody to come. It's not a prayer house, oh. It's a knowledge hub. The things you need to do for a successful outcome in fertility. Full stop. Everything fertility, right? But if you find me anywhere else on TikTok, which country are you from? Baka di. Your name plenty. Your name is Baka Lebos Lady. All right. So I was saying that if you find me anywhere else on TikTok, I may just be having general health talk there. So I also want to join. Got a lot of things to share. Is that okay? All right. So I think this person is asking which country. Nigeria. Nigeria. I'm speaking from Nigeria. So you want to join us. So see you guys on Monday, 7 p.m. Nigerian time. We will continue our third trimester um, journey to parenthood, right? Then if you want to join the Green app, everything I say and more, anyway, more than what I say on the live stream, I usually drop it in the Green app. You subscribe to join the Green app. That's the only condition. So, and if you are a subscriber here and I've not joined you to the Green app, please tell me. Right? You either subscribe on TikTok or outside TikTok. If you want to subscribe outside TikTok, just send me a DM and I will direct you. Doctor, I have simple ovarian cysts. Postmenopause. No. Is there any other symptom? Is there any other symptom? Rose. Besides this thing you just said, now is there symptom? Pain, bleeding, any other symptom that you need me to know? All right. So see you guys on Monday.
It's hope and it's pain, tears in the sunshine, love in the rain. Every scan's a story, old souls and new.
Go and treat the PID. Bless him.
Just the witness in the heart.
Go and treat the PID.
Some news breaks hearts like glass on stone. I see the fear, but I stand alone. I hold their silence.
All right, that's good.
Praying they find peace through the years. Some come back smiling, some never do.
8 months. How about exercise patient now? What you should do is to exercise patience.
They help me see this work's a blessing wrapped in mystery.
It's a joy and a storm. It's hope and it's pain. Tears in the sunshine, love in the rain. Every skin's a story, all souls are new. I'm just a witness in the heartbeat.
Today I saw heaven, today I saw loss. Some dreams took flight, some dreams got crossed. Still I thank the stars, and I stand true to the silent songs of the heartbeat. The heartbeat blues.
Good night, everybody. See you guys on